Hi, I'm Lester Power with Genesis Medical. Today I'll be walking you through a negative pressure dressing application. I'll be using the Gentex dressing kit that features lipogel. I intend to show you the basic principles or application of the dressing. If you are in need of more information, please feel free to contact us, as I don't have the time right now to go through every possible scenario. But hopefully this walkthrough will give you the basic understanding and concepts you'll need to know to successfully dress a wound that needs negative pressure. First thing I always do is recommend an optimal wound site. So first thing we always do is sanitize our hands. I use hands first. It's a moisturizing agent, and it also will actually protect and fight bacteria for up to 2 hours. I'm sure you have something, just remember to clean your hands. Next thing I'll do is we want to ensure the wound site is prepared nice and clean. We use microcin, kills 99.9% of all pathogens within 30 seconds. I'm sure you have access to something, but I always recommend cleaning the wound. Once we have a nice clean wound bed, first thing I'm going to do is take skin prep and just apply the skin prep around the peri wound. This is going to do two things. It's going to actually help ensure that our drape that we apply is going to adhere to the skin, and it's also going to protect the skin when we go to remove the drape, protect against skin tears and the like. Once our skin prep's dried, the next thing I always recommend is window painting or bordering the wound. There's a couple different ways we can do that, but I find the easiest is just cutting 4 strips and placing along the edges of the wound. This will protect against maceration if I have any overlapping foam laying on the peri wound, and it'll also help us achieve a seal, or help secure our seal. The drape I'm using right now is a 1-2-sided drape. There's many different options out there. I've seen 1, 2, 3, 4, and like I referenced earlier, this is a 1-2. The secret in cutting the drape is always ensure your pull tabs are in place. I've got my 1 and I've got my 2. If it was a 1, 2, 3, 4, I'd want to make sure those are intact as well. Otherwise, it's near impossible trying to figure out where to pull the drapes apart. Now that I have my strips cut, I'm simply going to place them along the peri wound. I'm going to peel my number 2, or my backing off. I'm going to do this all the way around the wound. By doing this, once again, we're just protecting the peri wound from possible maceration. And I would do this regardless of how much exudate is associated with the wound. Just a nice practice to get in the habit of doing. Once we have our peri wound covered or window framed, next we're going to take our foam that's in the kit. It's going to look much like this, and we're just going to cut it to the shape and size of the wound. The question I get asked most often is, what's the correct size, or how do you size the foam correctly? There's not an exact science. It's a little bit of arts and crafts, quite honestly. What you want to ensure against, though, is when we cut our foam, we want to keep in mind that it's going to contract once we apply the negative pressure or the vacuum tube. So if we cut our foam too small and it contracts and we have the wound exposed or the foam not in contact with the wound bed, what will happen is we'll have that great granulating tissue that's in contact with the foam but where we have no contact with the foam, we're going to start to develop necrotic tissue, slough, eschar, and then we're going to have some explaining to do. Conversely, if we cut it too big and we're packing it in there, we're actually impeding the closure of the wound. So the term that they use is you want to loosely obliterate the dead space. It's okay to have a little bit overlapping to the peri wound. That's why we window framed. We wouldn't want the foam actually to come in contact with good skin, as this would lead to maceration. So we're simply going to cut our foam to the shape and size of the wound. Once we have that, our next step is to apply the lipogel. Lipogel does two things. More and more clinicians are theorizing that what happens with our negative pressure systems is for the first 2 or 3 weeks, we're really excited. We see this accelerated healing rate, and then inevitably it plateaus. We still see healing, but not as significant as the first 2 or 3 weeks. More and more clinicians are theorizing that what's happening is you have these polymicrobial colonies in the wound bed, and they're going as far to say that because of the open cells of the foam, they're actually communicating to one another and building up biofilm. And once we have biofilm in place, that inhibits the healing rate, and the doc has to go back in there and debride. By using the lipogel, we're addressing that. We apply the lipogel in a circular motion, or almost an icing, if you will, on the side of the foam that's going to come in contact with the wound bed. It goes on in a gel consistency. Once it comes in contact with the wound exudate, it's going to change to more of a paste consistency, almost a peanut butter. We're still going to allow the exudate to pass through, but by having the lipogel, or a lipid membrane, in place between the wound bed and the open cells of the foam, we're keeping those polymicrobial colonies separate. We're not allowing them to use the foam as a conduit to communicate or reconstitute biofilm. That's one of the applications for the lipogel. The other application is anyone that's familiar with negative pressure and uses foam knows that it's great for negative pressure. Because of the open cells of the foam, we're actually pulling the wound bed up into the foam. That terminology is called microstrain. And by pulling the wound bed into the foam, we're actually creating more surface area for the negative pressure. As a byproduct, anyone that's done these dressings knows when you go to remove that foam from your resident, it can be quite painful. You actually have the wound embedded into the foam. It's almost a form of debridement. They don't even use the terminology wet to dry anymore, as that's considered a form of debridement. So by having the lipogel in place, we're still allowing that wound bed to come into the open cells of the foam, creating that microstrain, but when we go to remove the foam, minimal adhesion to the wound bed. Much, much less painful for the actual resident. So now that we have our lipogel in place, you don't need to cover the entire foam. About a dime's width is good enough, and just in a circular motion, we're actually going to place our foam into the wound and move the foam around a little bit just to distribute that lipogel that we've applied. Once we have our foam in place, we're going to take our second dressing from our kit, and we're simply going to cover up the entire wound. Simply peeling off my number 2, or my backing. And now all I'm going to do is I'm going to create a little opening, or a hole, right in the middle of the foam dressing. About the tip of an eraser should suffice. You want to be cautioned against just cutting a slit. I've seen what could happen if we just cut a slit. The actual suction or the negative pressure, once applied, could actually cause that slit to close upon itself, and we would have a seal above the dressing, not down into the wound where we need it. With my opening created, I'm simply going to take our connection tubing and our adhesive disc. It's a dual-sided adhesive on both sides. I'm simply going to peel off one side, apply it to my connection, get a nice good seal, And now I'm simply going to peel off the second adhesive side, just like that. I'm going to marry up the hole I created with the hole in our connection tubing, keeping in mind which way you want your tubing to run. I'm now going to take my connection tubing and hook it up to the tubing from the actual machine, in this case the Venturi, simple Christmas tree adapter. I've got it connected. Now simply all I need to do is turn the unit on, and within a couple moments we should see contraction. And that's your basic 101 on negative pressure dressing. Once again, if you need more information or would like to schedule an in-service, please feel free to contact us. Thank you.